Prostar device. This has got 4 needles which are housed within this section of the shaft of the delivery system, and you can just see the tips of the needles protruding there, and you can just see a little bit of suture protruding there. So there are 4 arranged at 90 degrees around the shaft and housed in here, and then this loop connects to a wire which runs down through the middle of the shaft, and then there's a plate here which, as you pull on this loop, pulls the sutures out of the shaft, and then they're captured within this part of the housing. And you can see there are 4 holes which the needles will then dock into. So the way this works is you puncture in a normal way, you then insert the device, and you need to get this plate of this barrel that's going to catch the needles right onto the surface of the vessel. And then with this in the hole, the needles then come out through around the hole at 90 degree spacing and are then captured here. And that gives you 2 crossing interrupted stitches. So it's 4 needles on each end of 2 sutures. The reason there's some advantage of this over the ProGlide device is that this can cope with scarred groins much better. The way that the needles are pulled out means that they deflect much less readily than the ProGlide sutures, the ProGlide needles. So with the ProGlide, the needles are on the outside and they're pushed in, and they can get deflected. They have to travel further before they're captured, and they're captured in a much smaller docking zone. So you only, a millimetre of deflection will stop the ProGlide working, whereas this has got a bit more of a margin for error, and you can get multiple bites of the cherry with this. You get this device in, and if you don't happen to capture the needles the first time, they'll either bounce off the barrel and you just can't pull this up any further, or they'll miss the barrel altogether and they'll just come out through the skin somewhere outside the patient, and you'll see them, and all you do is you push them back in, adjust the position of this, make sure that everything's accurately in place, and then I'll try again. Up against that, so as the needles pull out, they come splay out
at that
metal level, and they splay out, and they so they capture the vessel wall, and that's why you put it in through. You deploy the needles in a small hole. So from that point of view, the principle's the same as ProGlide. You also got a wire channel tip, and then a sort of rapid exchange port with a valve in. On the back, you've got that little tube, which is connected to a port for blood, and that proves there's a little hole on the back of the device there. You can just make out.
Proves you're in.
And that proves that you're in the vessel. You can flush this. You can see saline coming out of that hole. The other thing that happens is you can collapse these wings down, and then you can rotate the barrel, and that just helps you make sure you can get this barrel right down onto the surface of the vessel. And this is key. You have to do quite a lot of blunt dissection to get something that size right onto the surface of the vessel. It's got a star on to make sure it locates back in the right place, because if it was a few degrees out, then it wouldn't capture the needles. The sutures are housed in these loops. I'm not going to pull them out, but the sutures are curled up within those loops. So basically what you do, puncture, put this in until the guide wire port is at the skin surface, take the wire out, and then it's inserted without any wire. It's got a J-tip, so it's atraumatic, up into air water until you get blood out of here. Make sure you've got good bleeding out of here. You're going to rotate that through 90 degrees, which unlocks it, and then pull the needles through, and we'll see the 4 needles appear.